So this is the lecture for Chapter 11. Since we are having an off-campus day, then this will cover what we would have covered in class tomorrow. So Chapter 11 talks about computers in the ambulatory care setting. And we start with a computer system. It's a basic system. It has these four components. So each of these four components will be in every basic computer system that you encounter. There's the CPU, which is the central processing unit. I did put extra notes in here on some of these slides so that you can write them in or do whatever you'd like on your copies. The CPU is the electronic circuitry within a computer that carries out the instructions of a computer program by performing the basic arithmetic, logical control, and input and output operations specified by the instructions. Then we have input devices, output devices, and software, and we're going to talk about those in just a minute. So this is a nice picture that kind of shows you how each of the different four components relates to one another. So we have the CPU in the middle here. Let's see if I can find my pen. So we have the CPU here, and then we have input devices over here, and those include things like a mouse, a keyboard, a scanner. It's going to be anything. You can use a microphone, anything that's going to put information into the computer. And then we have output devices over here, and those include things like monitors, because whatever you put into the computer on the keyboard pops up on the monitor back out to you, printers, modems, and then things like CD-ROMs. So different types of computers that you need to be familiar with. There's personal computers. Everybody kind of knows what those are. Those are your day-to-day average laptops, desktops, those type of things. There are supercomputers, and that's a computer with a high level. That's the important thing there. It's a high level of computational capacity. Mainframe computers are used primarily by large organizations for critical applications. They process a lot of bulk data, things such as census, industry, consumer statistics, enterprise resource planning, and transaction processing. So mainframe computers are used by very, very large companies that have a lot of data that they have to process. And then we have mini computers. And back in the 60s, mini computers were marketed as smaller, more affordable versions of those very large mainframe computers. And then lastly, we have microcomputers, and those include things like smartphones, PDAs, which is like personal digital assistants, tablets or netbooks, and then our laptop and desktops. So our laptops and desktops are more commonly known as a PC, but the PCs that we know and use every day are actually under the category of microcomputers. So hardware involves components that you can see, touch, or hear. The data input devices, again, these are things that put information into the computer, include a microphone, a keyboard, a mouse, a scanner, things like that that you saw in the picture. Then there's the central processing unit, that's also considered hardware. A data output device could be a printer or monitor, as we saw in the picture. And then we have data storage devices, which is ROM and RAM memory, data storage memory, and then RAID storage. Software is frequently referred to as the computer program. The system software is the operating system, and the operating system is the system software that manages the computer hardware and software resources and provides common services for computer programs. All computer programs, excluding firmware, require an operating system to function. So if you do not have an operating system outside of firmware, then you will not have a functioning computer. Application software, that I didn't put any notes in here for you, but that's very much like each of the applications you have on your phone. It's the software that supports whatever program it is that it's working in. And then drivers are components that are used to interact with the hardware devices. Okay, documentation defines how programs operate. It also involves patches, which if you have apps on your phone like most people do these days, you'll know that sometimes there'll be some glitches in the software. And so the documentation will involve a patch to fix that glitch. Also involves licenses. With almost every single app that you download or every computer program that you install, there'll be an end user license that you will have to read and agree to the terms of in order to use that software. We have hardware and software, and they have to have compatibility. So if the hardware is working but the software is not working with the hardware, then we won't have a computer that functions very well. So computer networks, networking is the electronic or optical connection of computers and the peripheral equipment for purpose of sharing information and resources. There are several different types of networks that you need to be aware of. A LAN is a local area network, and I wrote in here, you'll find LANs in places like schools, residences, doctors' offices, campuses, smaller geographic regions. They only cover a very small area, relatively speaking. And then wide area networks, or WANs, they cover very large geographic areas. And these usually are established with leased telecommunication circuits. So it may have like Sprint may have a WAN for the Bay Area, and Verizon may have a WAN for the Bay Area. So everybody who's hooking onto their network can utilize their services. And then we also have the internet, and I'm pretty sure all of you guys know what the internet is. Connecting networks include a hardwired system. So that would be something where it's connected to, like, for instance, the computer is connected actually to the printer with a cord. We also have wireless systems. That includes Wi-Fi, Bluetooth, satellite, cellular technology. And those would be things like a wireless printer where the laptop is on one side of the room or the desktop is on one side of the room and the printer is on the other side of the room or in another room altogether, and it wirelessly prints. Sends the print job to the printer and the printer will print without having a hard wire connected. And then we have WiMAX also. So system security include things like the operating system, the firewall, antivirus software, passwords, and training. So the operating system has a lot of security features built into it already. And then we have firewalls, and those like help protect us from malicious attempts to destroy our operating system. And then we have antivirus software, and that software is geared to help eat viruses or kill viruses off that could come in and damage your computer system. We also password protect almost everything these days. And then another way to keep your your system secure would be to have appropriate training. We can do things like inventory control, data management, data backup. Data management is managing the amount of data that we have stored in one certain place. Backing up data is incredibly important in a healthcare practice because that allows us to basically make a carbon copy of our data and keep it someplace secure, typically off-site. We have manual selection of Wi-Fi access points. There's personal access points. You can deactivate file sharing by your computer, and you can also enable email encryption. I'm not so concerned that you guys know a ton of these. Definitely know data management and data backup, though, because those two are very important. The rest of them you should definitely read through. There may be something on your exam, but I know for sure that you definitely need to be aware of data management and data backup. Okay, so system security with this little graphic here, there are virus protection programs and then also the recognition of secured sites. So the recognition of secured site, if you see this and the HTTPS, the S at the end of that indicates that it's a secured site. Also, a lot of times you'll see the little padlock over there, and that also indicates that it's a secure site. So system security again involves firewalls where and backup where we create a barrier for our operating system to not be attacked, and then we back up our information on our system from our files and our servers and all of that business so that we have a carbon copy should we be attacked and have something destroyed. We have a backup available to us to restore our systems from the point of the backup. Power outages, electrical surge, static discharge, protection devices, they're all things that we can do to help eliminate some of those things. Electrical surges, we use surge protectors. Static discharge, we often use special anti-static mats at workstations to help reduce the amount of static discharge that could potentially harm our computers. Okay, so cloud computing, cloud computing is kind of like a computer rental agency where the order is placed for applications or apps to be performed. So it provides all computing needs for fixed service price on a pay-for-use basis. So basically, you only pay for it when you use it. It also helps us reduce costs. It has been an improvement in resource availability time, has more secure data backup, and it has much better disaster recovery. So if something happens, think about this. I mean, I know a lot of you guys aren't even old enough to have phones that flipped open back in the day, but just maybe, 8-10 years ago, we had flip phones. And there were no clouds, there was no iCloud, there was, no OneDrive, there wasn't any of that. And so if you dropped your phone in water, your little flip phone in water, you lost everything. There was no recovering that. But now, most of us have iPhones or, Galaxies or something that has some type of cloud backup. And so if I drop my iPhone in water, all I have to do is go back on iCloud when I get a replacement iPhone and download everything that I have backed up to my iCloud, and everything comes right back. All my phone numbers, my pictures, all of those things. So cloud computing really does make backing up and disaster recovery much more efficient and much quicker. Okay, so office personnel have to help maintain the computers, and we do that by replacing printer ink and toner cartridges and refilling paper trays in the printer / copier. We can do disk defragmentation, which helps kind of clear out a bunch of older things that we don't need. We can remove files that we're no longer using. We can also have the installation of security patches, and then also manage the service agreements. Okay, so use of computers in the medical office. We have general office procedures, things like word processing, spreadsheets, graphics, databases, online communication programs, and accounting programs. All of those things are very basic functions on a computer within a medical office. And then more importantly, we also have maintaining EMR, which is electronic medical records, and EHRs, which are electronic health records. Also, there is practice management software, and the Harris Care Tracker program that you guys are working in labs, that is a combination of EHR and PMS, which is practice management software. So you guys get to see both sides of that. And those practice management softwares help manage a clinic or a practice. There are also specific clinical and laboratory applications that can be added to an EMR or a PMS software component. And so that would allow us to do more specific things on the side of clinical medicine. And then also like ordering labs, uploading lab results, faxing them to providers, and that sort of thing. Okay, so you want to know the difference between EMR and EHR. And EMR involves individual patient records, and EHR is a bunch of combined EMRs from a variety of sources into a master database. So for example, you go to Dr. Smith and you have an EMR with him. And then you go to Dr. Jones and you have an EMR with him. And then you go to Dr. Chang and you have an EMR with him, and Dr. Dawson and have an EMR with him, and then Dr. Hernandez and have an EMR with her. Okay, so you have all of these different EMRs from all of these doctors, and those are all your individual patient records within that physician maintains that individual patient record for your encounters with them specifically, individually. Then the health system, say all of them work for Muir. They all work for John Muir. And so then you will have a combined EHR record with John Muir that combines all of your records from Dr. Tang and Dr. Dawson and Dr. Hernandez, and Dr. Jones and Dr. Smith and whoever else I said. So that's kind of how EMRs and EHRs work. A TPMS is a total practice management system. It deals with the day-to-day operations of the medical practice. And so you're learning how, within that Harris Care Tracker program, you are beginning to learn how to use a TPMS. It's Certification Commission for Health Information Technology. So that's how TPMS systems get their credentials, is through the Certification Commission for Health Information Technology. That's kind of like the seal of approval for TPMS systems. So if you are ever, I don't know that you ever will be, but if you're ever in a position to begin shopping for TPMS systems for a practice, then you definitely want to look for that accreditation. Okay, so there's some data flow here for you. You can look through that. The same graphic, I believe, is also in your textbook, but I'm going to move right past that. So the use of computers in the medical office continued. We have portable computers that we're using in the medical office these days, which are really nice. They are PDAs. We also use smartphones and tablets to help us right in the room with the patient. So before, maybe 3 years ago, 2 years ago, there were never computers in the patient's room. It was always, handwriting things on a chart. Well, now we've switched over to EHRs and EMRs, and so we have to drag computers with us everywhere. And so some people have, actual laptops up on rolly carts, and they roll them from room to room, patient to patient. Other practices will assign a smartphone or a tablet or a PDA to each individual office staff member, and that's what they will use the entire day to correspond with the EMR regarding each patient that they are involved in the care of. Okay, so when we're looking at design considerations for a computerized medical office, there is software selection, and we want to make sure that we choose knowledgeable and trustworthy vendors for our software. We want to also develop a plan for computerization. I think I mentioned before that the law was put into place with the Affordable Care Act that by 2014 everybody had to be fully digital with their medical records or pay a hefty fine. And so most places have now complied with that because nobody wants to pay fines. It's no fun for anyone. So most places already have a plan for computerization, but if not, then you'll want to develop one if you're going to select a software. Hardware selection is going to determine whether you're going to network, which means whether you're going to be hooked up to a bunch of other computers, or if you're going to do that hardwire or wirelessly. Usually the hardware selection must meet minimum requirements for software programs, and then also must meet minimum requirements for data transmission. So for the few of you who are old enough to remember dial-up internet, that would not work with a network that would be built today because the download speeds and the connecting speed is so ungodly, incredibly slow. So just kind of to give you an idea of how that the minimum requirements for data transmission must be met, there is no way you can now download now transmit more data through your smartphone than you could probably through one of the dial-up connections from 15 years ago. Okay, so more considerations. We have ergonomics. We want to make sure that we consider eye strain. Eye strain is a big deal when you're staring at a computer all the time. You also want to consider things like posture and neck strain. If the computer is down, we want to try to make the screen as eye level as possible so that you're not bent down all the time looking at it, and that you're not straining your eyes any more than you have to. Using footrests can also help with posture problems, and we sometimes will have ergonomic chairs that have a curvature in the lower back to help keep the back kind of in line and where it's supposed to be. One thing I forgot to mention here, and I don't know if this is coming up, but one thing that you should know is that carpal tunnel syndrome is like the #1 consideration when we are trying to figure out how to ergonomically design a computer workstation, because carpal tunnel syndrome is the #1 injury that is related to computer usage. Okay, patient confidentiality, we have the adherence to HIPAA regulations. We have to ensure that computer illiterate personnel are employed to set up the system. A lot of this is part of, hang on, let me think of the name of it. It's called meaningful use. That's what it's called, meaningful use. And that means that a person who is going to have access to an EMR, an EHR, or a TPMS has to have some type of credential in their field so that they are using that TPMS or the EMR or EHR in a meaningful way that is not abusive to the patient's privacy. We also have to establish protocols regarding patient confidentiality, which means we define who can access and modify data. We have to provide identification, dating, and authenticating mechanisms for those changes and additions. A lot of times they'll do like thumbprints or ID badges that they scan to the computer that will unlock the computer for them to participate in that patient's chart. Okay, so persons other than authorized personnel should not be able to read the files that are in an electronic record. Firewalls are in place to help prevent that. Passwords and PINs should never be shared. Printers and fax machines should be located where unauthorized personnel cannot view them. So that way, if something comes across on a fax, lab results or whatever it may be, they won't be able to be viewed by somebody who has no business looking at them. And then we also have to maintain AMA computer confidentiality. So there's some standards in place for protecting private health information, and those include confidentiality protocols and procedures, staff training, the identification of authentication protocols, access control of computer output, modification, and destruction of files, security of transmitted data, and then lastly, the control of discarded records, storage of media or computer hardware. Anything that has protected health information on it from patients has to be treated with the utmost care so that we maintain the patient's privacy. Okay, so moving on to professionalism in the computerized medical office, you want to make sure you pay close attention to detail when entering or retrieving information from the computer. Don't leave a patient's records up on screen so that somebody else who's checking in at the front desk could possibly see that. Don't call them, necessarily by first and last name. Use last names only, Mr. Smith, Mr. Latona, Mr. Tang, things like that. So that way you're protecting somewhat of their privacy when it comes to calling them up to the desk or calling them back to a room. You want to work within the legal scope of your training. I cannot stress that enough to you. The legal scope of your training can be a big deal if you step outside of it. So you want to make sure you're working within the legal scope of your training, and you should learn all about that in your law and ethics class. Next, we want to become actively involved in professionalism and then make sure that we're able to adapt to change so that we can keep up with, new and innovative solutions to helping protect patients' privacy and to maintaining professionalism. You always want to have a good work ethic. That's very important. Medical offices are quite often very busy and they are, fast paced and there's a lot of people in them. And so having a good work ethic will help you be much more successful when it comes to your position. If you have a good work ethic, then you're okay. You'll roll with the punches and you're willing to put in the extra work and you're willing to do whatever is best for the good of the office. So I know we talked about this a little bit before, but I can teach you how to work computers and how to work, practice management software, but I can't teach you work ethics. So that's something that you all have to work on, by yourself and should definitely be prepared to develop as you go through the program. You don't want to call into work. You don't want to be late to work. You don't want to leave early from work. You don't want to do a lot of things. So, I mean, those are all pretty standard things. However, the repercussions of doing those things in a healthcare facility are a little bit different than the repercussions of doing those things, say, at Taco Bell or, a fast food restaurant. So just be mindful of those things. You want to also enhance your skills continuously through continuing education. And then realize that the electronic health record affects the entire office staff. Everybody, has a role that they play in the electronic records portion, and so, you don't want to do something that can potentially create a whole bunch more work for, another staff member. And that is the end of a very short chapter 11. So I'm gonna see you guys on Thursday and work on your office projects tomorrow, and talk to you soon.